Good morning, good afternoon, and good evening to you all. My name is Klement Camaj, and I am the Associate Director here at Path for Europe. First, let me extend my hopes that you are all well and staying safe during this pandemic. Second, I would like to take this opportunity to personally, as well as in the name of our think tank, to thank you all for turning into our webinar. PfEU was founded at the beginning of 2020 as a think tank focusing on the future of the European Union. Our team is exclusively comprised of young researchers, PhD students, master students, and young professionals. We conduct research, develop policy advice, and we want to foster engagement for Europe through debates and talks like the one today. The WebTalk is part of our event series called the Coffee Conversation COVID-19, in which we want to explore the impact of COVID-19 on a variety of EU policy areas. In 5 different WebTalks, experts from Europe and beyond will share their thoughts on current policy challenges and how to navigate them. Just a quick reminder for all of you, you can ask questions at any point during this talk. Just please use the Q&A function available and write down your questions, and we will answer them accordingly. The topic of today's talk is European Union's global response to COVID-19. We are joined by Friederike Röder, who is currently the Senior Director for Government Relations and Foreign Policy for the social action platform called Global Citizen. Global Citizen is one of the world's largest movements of engaged citizens using their collective voices to end extreme poverty by 2030. Friederike was also the director for the EU and France at the One campaign, an international advocacy organization that fights extreme poverty and preventable diseases. Hello, Friederike, and thank you so much for joining us today, and we are honored to have you. The stage is yours.
Thanks a lot, Clement, and thanks to all your colleagues. It's really a pleasure to be here today, and it's great that you're kicking off this series with the global response, which I think is really important, and it's a very live issue at the moment, as the EU is taking the lead, actually, or trying to take the lead at the international stage on actually providing the right global response to COVID. I would suggest that I kick off with a few preliminary remarks on why such a global response is actually important and what it actually entails and where the EU stands at this stage. And then we can enter the discussion.
Absolutely. That sounds great with us. Please continue. We're very excited to hear what you got to say, especially about EU's global response to COVID-19.
Great, thank you so much. So maybe I start with stating the obvious, but it's unfortunately in these times it's really important to do so. Is that I think COVID shows us one thing, is how interconnected this world is, and as a consequence, basically, that we won't be able to control this pandemic if our action isn't global. So basically, if we won't be able to control it in Germany, France, or Belgium, if we're not able to control it in Togo or in the DRC. I think this is something that especially the European Union has actually realized pretty quickly and early on, which is definitely a good thing. But obviously then the question is, like, what do we do with that? And maybe just to give you a few first pointers of what actually global response means. So I also already mentioned basically COVID doesn't know any borders, so shouldn't our action. And especially we need to, or we bear specific responsibilities with the poorest countries that have the weakest health systems, and where it would be even more difficult to slow down and eventually control the pandemic. And if we see how Europe was actually already struggling, or is still struggling to do so on its own territory, can only imagine what this will entail, for instance, in certain African countries. So just to give you one figure, which I find very telling, is that we're obviously speaking a lot about the ventilators that are needed. And Mali, which has a population of more than 19 million inhabitants, actually has a single ventilator. This was at the start of the crisis. I mean, aid is starting to arrive, but you know that I mean, Europe also had difficulties actually of having sufficient number of ventilators. And now imagine what this means for a country like Mali. While Africa is a bit behind the curve, what we see today is that the latest data basically suggests that all of the African countries have COVID cases. I think one exception might be Lesotho, but unfortunately, I'm not sure they will stay in this in the category of not having a case. And we see already the pandemic picking up speed there, and more people being infected and more death occurring. So it's not as if, I mean, we could have hoped for a miracle sparing the poorest continent on earth, but unfortunately this doesn't seem to be the case. And the other thing that I wanted to mention is that while I think the first thing is actually the global health response, what we also need to keep in mind, and this is the whole difficulty also of managing this crisis, is to already think about the other implications. So for instance, if we are already seeing that our economies would be shrinking quite significantly, the same and even worse is going to happen to the African continent, which is particularly dependent, for instance, on Chinese trade. And I think this has like two direct implications for Europe. I mean, first of all, Africa has been an important trade partner for Europe, and actually also a growing market. And the other thing is obviously that we know that, I mean, our two continents are so interconnected that it can't be good for us if, for instance, more and more people are dropping into extreme poverty just across the Mediterranean. And you might have already heard it, there are other spillover effects that we also actually see in European countries, but it's just that those effects are exacerbated in a context of countries that already have to deal with extreme poverty, which much more extreme climate change issues and so on. So one is, for instance, that you know, food insecurity has been on the rise, for instance. So just this as pointers of what it actually means to develop a global response. It does obviously mean to be coordinating with other global powers as part of the G20 and the G7, to be trying to keep up the dialogue, both with the Chinese and the US with different difficulties and so on. But it also really means to have a strong response for what actually is going to, what Africa is going to be facing. Maybe now quickly on to what Europe has done so far and what is still actually, what still needs to be happening. Maybe, and those, I mean, two are kind of interlinked. I mean, the very first thing that they actually did is that they did come up with a kind of an emergency package of 15 billion euros, which is pretty impressive and was definitely the biggest emergency package for least developed countries in general, but in particularly also for Africa. And what they basically did is that they reallocated money. So there are lots of, if we just look at development aid, there are lots of programs that had to be stopped because of COVID. So this money could be reallocated just to ensure that health staff, for instance, gets the right training. So that's, I think, fine to do in a very first emergency step. The other thing that the EU did, and this will have loads of implications for Africa or other poor countries, but more is actually really of global importance, is that they've called a pledging conference, or they're now calling it actually a rolling replenishment, and I can say a few things on that. But basically they're trying to take the lead in mobilizing the funding to be able actually to develop the tests, treatments, and also the vaccine that we need to put an end to COVID. And why it's important actually to join forces here, because one could think, okay, why is this actually part of the global response? Why is it just not the European Union getting their act together and putting money into research, has different reasons. I mean, one is actually that the needs are really, really important, and it's much better to also have support from other parts of the country, of the world, and to pool funding. And to be, for instance, also coordinating clinical research trials across the world, because really, I mean, what's really needed to be able to fast track the development of a vaccine, but also of tests and treatments, is really global coordination and cooperation. And the other thing, and this is a bit more scary, but a really, really, unfortunately, a really real threat, is of course that once a treatment or a vaccine is being developed, there needs to be already a mechanism in place to ensure that this treatment and or vaccine is actually accessible for everyone. The worst would be if it's being basically monopolized or by one country or by one company. And unfortunately, the world we're living in today, this is a real threat. And so the idea that the European Union, but actually also different member states like France, are really pursuing is to set down a few principles of global coordination and getting everyone around the table, and then also to collectively mobilize the money needed, actually from governments, but also from private sector, from foundations, to ensure that we can actually fast track the development of tests, treatments, and the vaccine. So this effort has more or less started already last Friday. The big moment is going to be Monday, next Monday, but needs are so enormous that probably the efforts will continue throughout May. So Ursula von der Leyen was actually speaking of what we call a rolling replenishment. So you don't have like one moment where you call in everyone and everyone puts their money on the table, but it's rolling. So you have different milestones where you will be asking people to come forward, people, governments, foundations, and so on, to come forward and to pledge funding. But this is obviously just a, I mean, it's terrible to say, but it's actually only a first step. We're already speaking a lot of money, a lot of efforts in actually coordinating this. I'm just going to very quickly say what the next steps are, and they actually basically need to come. I mean, everything has to happen at the same time. First of all, let's start with the vaccines, treatments, and so on. We actually already have to start now to increase the capacities of production, and then also to come up with the right pricing strategy and a rollout strategy, because as soon as we have a treatment, a vaccine developed, we obviously want to make sure that we can produce it in a sufficient amount, and also ensure an equitable access to it across the world. And this is obviously a terrible headache. The other thing that needs to happen is that, and that's part of it, is that especially a vaccine really needs to get into the poorest countries of the world, because as I said, we all need to be safe of COVID. If anyone is still left behind, no one will be safe. So it's really in our very own interest to ensure that Togo, for instance, has the capacities to be able to roll out the vaccine. Which means that it's not just about producing the doses of vaccines once it's been developed, but it's also obviously about actually training health staff, ensuring that cold chains are in place, strengthening the health system more in general, and that requires funding. And then I did already mention the 15 billion that the European Union has freed. This is reallocation. So actually what this means is that other gaps have been created, right? For instance, in education programs. So these will have to be filled. And at the same time, we have to address like the collateral damage of, for instance, the food insecurity situations and other, let's say, problems that have actually increased in the meantime. And longer term, there's obviously the big question is obviously how can we actually prevent something like this happening again? And that's a whole different story, and will need a lot of new funding and also more, let's say, structural ways of finding this money. Just 2 pointers here. One is that the European Union is in in the very difficult situation, but maybe actually it's also a chance that their multi-annual financial framework is coming to an end of this year. And then they have the opportunity to actually come up with a new budget, which will last until 2027, which is really up to the challenge of preventing such a pandemic of happening again on our own territory, but also globally. And the other thing is actually something that just came from Berlin a few days ago. Chancellor Merkel, in her podcast, was giving a first introduction of what Germany would like to do with their EU presidency, which is going to start in July. And two big issues on the agenda are health and climate, which is great. And what she also said that there is a need to find new funding sources. And one of those options is the introduction of a financial transaction tax, which could fund both the health challenge and the climate challenge. So I'm going to stop here because this is already a lot. I could go on, but I really want to have the discussion with you. But I hope that this gives a good basis for this discussion.
Well, thank you so much, Friederike, for that very, very interesting and introduction and the details that you've given us. Truly, it's enlightening to see the impact that COVID-19 had not only in the EU but globally. But that being said, I mean, we were looking at it as from a bird's eye perspective, kind of, and you spoke about the economic solution to this issue in the form of the pledges. You talk about the vaccines in form of a solution as well. But is there a local solution to this global problem? Should the EU devote part of its support to the institutional strengthening of local governments? Because we see it today, for example, from the tiny country of Montenegro to Italy, right? Countries have decided to leave it to municipalities to find a solution to protect themselves rather than the government to protect them.
Yeah, I couldn't agree more because, I mean, let's take the example of the vaccine, because in the end, it's only a vaccine that will get us out of the pandemic. But the worst that could happen is actually that we develop a vaccine, we are able to manufacture it in a sufficient amount, but then we're not getting it to the people who need it, right? And I think that this is where indeed the local level comes in, and also where it's not just about solely a health response in itself. It's not just about ensuring that nurses are actually in the clinics, but it's also about the right regulatory environment, about ensuring that the funds are not getting embezzled. As I said, that the cold chain works, this is logistics, this is infrastructure. And so I couldn't agree more that this also requires strengthening of local administrations, which are local authorities, which is something that the EU, I mean, both the Commission and member states actually already do quite extensively. There are also interesting partnerships sometimes from one municipality in Europe with one, let's say in Africa or in another developing country. I think the big risk with this crisis is that everyone is obviously thinking about what can we do now to save lives, which is the right thing to do. But we very quickly need to pivot again to ensure that other tracks are not being neglected, and one being, for instance, the support for local authorities more generally, because they will be crucial in ensuring that this global response is actually in the end successful, and it will only be successful if it reaches every single human being.
Now, knowing your expertise being in government relations, and knowing that your expertise is also in foreign policy, let's switch a little bit into geopolitics. Today, we see that many EU countries are tightening up their borders, and essentially recreating their land borders during. Is European Union solidarity and the Union threatened by the border implications that of this virus of COVID-19?
I think that that this is a real threat, and and most importantly, it's not the response, right? I mean, not the solution. I think, I mean, again, I think we are in an emergency situation, and yes, we, like, a lot of countries closed their borders, but in the end, it doesn't really affect us because we are actually confined at home, right? So we're restricted in our mobility anyways. But of course, I mean, it's not the right reaction, because I think symbolically, like, closing the borders is basically saying, like, I'm going to deal with it on my own, and we know that we won't be able to come to terms with this pandemic on our own, not within Europe and not globally. And what we've seen is that the virus doesn't know borders. It doesn't care. Like, you can close borders, and it will, I mean, people will and goods will continue to move around. And actually opening up borders, or at least keeping up the principles that I mean, that we built, that Europe has been built on, is, I think, really important, because in the end, this will also help us. I mean, we have to lead by example if we want to mobilize other parts of the world to do the same. That's the first thing. And then the other thing, I mean, we know that the economic effects also will be quite terrible. And this, I mean, won't help if we're restricting, for instance, mobility, or turning the back on cooperation. The third thing is, I think we're actually, this is really against our own interests, because we've seen that we are actually relying on a lot of imports, for instance, from China. So we need to keep borders open, and we need also to be very aware what our responsibility is, because, for instance, I believe that there are certain equipments. I think actually ventilators are one example that come mostly from the European Union, and it would be terrible, obviously, to close down the borders and for instance, prevent them of getting onto the African continent.
Thank you so much. That is very, very interesting. I would like to go back a little bit on the economics, because it's very interesting. We talk about ventilators, we talk about vaccines, and in the end of the day, it all goes back to the economics, right? You started talking earlier a little bit about the global pledging, and I would like to know more, if you can elaborate a little bit more on the global pledging efforts recently proposed by President Ursula von der Leyen.
Yeah. So what basically happened like a month ago or so is that the G20 convened at heads of states level, I mean, through a Zoom meeting, I guess. And they found exactly the right words. I mean, the declaration reads great, like, we need to fast track the development of a vaccine and so on. But the reality is that these were only words, and that the development of a vaccine is just very expensive, and especially if you want to fast track it. Normally, the development of a vaccine takes, I mean, even if you're throwing all types of resources at it, it takes, like, I think 6 years or so. Now we could probably fast track it, and it would take 18 months, which is still terribly long, but only if the funding comes together to really be able to launch as many clinical trials as possible. So this is like where Ursula von der Leyen took the lead, and rightly so, and said, okay, acknowledging the fact that we very, very urgently need this funding to come together, she convened like a pledging conference, or maybe it's now a pledging campaign, which would actually, like, what it aims to do is to mobilize at least 7.5 billion euros that would go to different multilateral institutions to do several things. One is to fast track the clinical trials for a vaccine. The second thing is to fast track the development of tests that are actually reliable, you know, because the tests that we have at the moment are not reliable enough to really help us to navigate the health response, the public health response. And then also the question of a treatment, right? I mean, if a vaccine takes time, maybe at least we can have a treatment, and a same thing where just the research needs to be funded. And so this is what is happening next Monday, but probably it's going to be like, there will probably be other dates in May to ensure that the money is coming together. And what is actually not yet costed, but will come on top of that, is actually to already mobilize the funding that will be needed to manufacture those, the vaccine or the treatments, and then also the rollout. There are people crunching numbers at the moment, but this is also why I think in the end she's rather talking about a pledging campaign, because the needs will actually grow. And the idea is to get funding from at least all G20 member states, but as I said, also from the private sector, from foundations. You know, the Bill and Melinda Gates Foundation has, for instance, already been giving quite a lot of funding. So it would be really something where loads of different parts of society need to come together.
Great. Thank you so much for such an elaborate answer and explanation to the issue. Now we're going to go to participants Q&A. So just one more time to remind all of you who are in this webinar today, if you have any questions for Friederike, please go at the Q&A tab and just write down your question, and we will most definitely answer it. Now, the first question that I see here, it says basically, due to COVID-19, will China start losing influence in Africa?
Yeah, that's the very big question. I mean, the question is also, what is going to be China's place in the world, right? More generally after COVID, and I think what I mean, without being a China expert, I'm saying this here very clearly, is that yeah, I think it's quite interesting just to see how they have now reacted. For instance, you may have followed this, but it's been like the Chinese embassy in France has been putting out a lot of tweets, basically, I mean, not very diplomatic, heavily criticizing France for their response to COVID. And at the same time, we see that China has been shipping material over to Europe, but also to Africa. What's definitely true is that, I mean, all the economies have taken and are taking a huge hit here, but that probably, I mean, trade between China and Africa will suffer from this. And it's basically, I mean, two ways. Like China will probably need less how do you call this? Sorry, I'm in French, matière première, like less imports from Africa, and at the same time, obviously, Africa will consume less Chinese goods. Sorry, less raw materials. I now found the English word. So yeah, I think it will definitely shift power relationships, but the big question is also how is Europe's going to be seen as a partner in Africa going forward, and this is probably also something that is at stake today.
Definitely. I mean, China and Africa are not the only countries, as we mentioned earlier, and you mentioned earlier. The entire world is suffering from this, and even the new Silk Road Initiative, Chinese new Silk Road Initiative, is definitely taking a hit today, which is, it's normal taking in consideration the circumstances that we're in today.
Yeah.
The second question states, Friederike mentioned the financial transaction tax as a way to finance the health and green initiatives. But should we not start with closing tax havens and taxing big corporations before?
Mm-hmm. Yes, yeah, this also came up quite a lot again in the discussion, and I think it's important that it's on the agenda again. I think it's not an either-or question, because the financial transaction tax, and actually the rationale behind it was always that let's say the financial sector has been an under-taxed sector compared to others. And after the big financial crisis, basically more and more people and also institutions were saying that it's only fair actually to tax them as we would be taxing, you know, other types of transactions, for instance, through the VAT. And so the proposal is on the table with the European Union, and it actually has been for years. It's good if it could now be fast-tracked. And in parallel, yeah, there is definitely the question about tax havens again. And you may have followed the fact that a few European countries are actually tying the subsidies or the aid that is going to corporations in Europe to the requirement not to be active in tax havens. Here, the big issue is actually is the definition of a tax haven. Like which country is a tax haven, right? And the even bigger question is like the potential tax havens in the European Union. So it's a very political question. But given that everything is kind of, you know, I mean, we're in such an exceptional situation that I think it can really open up new spaces and allow maybe for new debates. And so I think it would be interesting to see what the European Commission will propose going forward, and potentially maybe with the support of the German presidency.
Absolutely, I agree with you 100%. In correlation to that, I really believe that this whole situation that we're all in together has impacted so many things, and to some extent will impact in the future, as you mentioned earlier, will impact so many different debates, right? No matter if we're talking about taxes or simple basic politics, the question will come, yes, but what if we have another COVID-19 again? Which is very, very interesting. Yeah. Another question from a participant states, you've touched upon the aid that is being made available for Africa. Can you elaborate on how the EU has responded to their neighbors in Eastern Europe and Western Balkans?
Yeah. So I was talking about the 15 billion package that they freed up, I think like 3 weeks ago or so. And this was a global, really the global response. So it also included funding, for instance, for the Western Balkans and the Eastern neighborhood, as well as Africa and other parts of the world. And I think what was also interesting as part of this package is that it included, I mean, funding, different types of funding, also guarantees, loans, but also the possibility for certain countries to join the procurement system that Europe has set up, you know, to be kind of bulk buying protective equipment, for instance. And I think that this is obviously non-financial aid, but I think it is extremely important. So I found that really an interesting element of the EU's response, especially for our neighborhood countries. Yeah.
Thank you so much for that. Yeah, it's very interesting to see, because some countries look towards the EU and some others look somewhere else, to put it lightly, which is not very, it's not very good to see, especially in such a region that is extremely prone to conflict. Next question is basically it's actually asking about Global Citizen. How has Global Citizen responded to this pandemic? What efforts have they taken in response to COVID-19, since we know you're the Senior Director for Government Relations at Global Citizen?
Yeah. No, very good question. I mean, as an organization, we have pivoted quite quickly to actually exploring what we could do to respond to this COVID crisis. And so when was it? Mid of March, we launched a campaign which is called Together at Home, which has different elements. So one is, you can find it actually on Instagram. So for several weeks, like we had everyday artists, you know, doing like little mini concerts from home. But at the same time, I mean, one thing was actually simply to support people with the shift of all of a sudden being locked down all over the world, but also to spread messaging around what needs needed to be done to limit the spread of COVID, like washing hands, social distancing. Now we have the impression that we already also, always knew how to do it, but back then it was a big shift that we supported through our public comms. And then also encouraging individual citizens, but also, let's say, richer citizens like philanthropists and also companies to actually donate to the WHO Solidarity Fund. And this culminated in a big event on April 18th, which was broadcast on TV and also digitally streamed with a number of artists. And but it was basically a platform or an incentive also for us to be able to actually mobilize especially the private sector further. So in total, we were able so far to raise around 128 million US dollars for WHO, but also for other organizations that are somehow involved in the fight against COVID somewhere in the world. And what we're doing now is that we're trying to support the EU's efforts on getting the funding together for the vaccines. So you can go to globalcitizen.org and, for instance, tweet at certain governments that haven't pledged yet. And then we will be following, obviously, what's happening on Monday. We do hope that at least a big chunk of the 8 billion come together. And on the back of this, we will plan the next steps. But as I said, very probably this won't suffice. So we will probably need to mobilize, continue mobilizing around this. With our global citizens, our supporters, but also ensuring that, for instance, corporates do their fair share of it.
Well, a big thank you needs to go to Global Citizen and everything they're doing, because since its foundation, every time the world faced a challenge, Global Citizen was there trying to help in any way it mattered, inform that they could and should. The next question states, talking about the EU's next step, quote, tackling other problems which came with COVID-19, could you please explain this a bit more in detail? How does this look like? Do committees focus on a country and all its problems, or are there committees focusing on one problem, example, healthcare, education, local economy, and try to help more countries?
Yeah. Yeah, so first of all, I fear that we don't even know yet the extent or of the impact of COVID across, different sectors. There are some that we already see, as I mentioned, like, for instance, food insecurity. So the EU is organized in a way, actually both the parliament, but also the council, so the member states, is that they do have like one committee, which is basically looking at everything that has to do with developing countries, but that that covers all the countries that are classified as developing countries in the world, and all the issues. They can then have different, working groups or kind of task forces on different issues. And probably this is what they will have to do, because I feel that there will be quite a lot of issues that will need our urgent attention very soon. The other thing that I'd like to mention is that, for instance, one big question is how we go about the fight against climate change, which is actually a very European issue, a domestic issue in that sense, but also a global one. So from time to time, I think it can be very important to have a specific focus on the poorest countries in the world, but sometimes it's also just important to keep in mind that this is really global action required across the board, and not just for developing countries.
Absolutely. This is where all the nations and countries have been closed up in themselves. It shows that we are all one. We're all interconnected, no matter how we look at it, no matter what flag you have on top of your house, and no matter what language do you speak. Something like this cannot escape anybody. Yeah. But it's very interesting to see the questions, because most of the questions are very political oriented questions. The second question is basically a two-part question. Part number one states, when the pandemic began spreading in China, why didn't the EU take a more proactive approach to put in place preventive measures, i.e. active testing and closing? And the second part is, what will the EU's relation be like towards China in the long run once vaccine is found?
Mm. Yeah, I fear that I won't have the full answer, but maybe part of the answer is that the EU, I mean, if we talk about the EU institutions, they have limited responsibilities or competences when it comes to health, for instance. So their action very much depends on whether the member states go with it and are actually happy to coordinate at European level. So I think if we ask, I mean, why did the EU response was so low? We actually need to ask the question, why was the French, the German, the Italian response so slow? Italians may be a bad example because they were the first hit and they were, I think, actually ringing the alarm bell, right? And others were not necessarily reacting. And what we see today is that while large parts of Europe are in lockdown, the policies actually differ quite a bit from one country to another. But I think what was important is that then the EU took steps like, for instance, they launched a huge procurement to actually ensure that they could buy enough masks and other protective material together. I think this is where we see the best in the EU, right? That if we get our act together and if we do things, I mean, not just on our own, but with others together, we obviously, I mean, we can negotiate differently with companies. We can ensure that I mean, it's really a win-win situation, right? If we work together, and actually it can go quite quickly. It's not just working together doesn't mean it must be slower. Because actually the EU procurement was actually quicker than some of the national ones. So I think this is a really good example, and it shows that while the response overall seemed to be too slow, and probably was, I think there are also very good examples. And China, I mean, China is part of the G20, and I think the big question is whether China comes in on those pledging efforts to find a vaccine, for instance. And I think it really very much depends on what role China wants to play. My impression is that von der Leyen did invite all the G20 countries to come to the table, to work together on finding the treatments and the vaccine, and I think now it would be interesting to see whether China responds to that.
Yeah, absolutely, I agree with you. It's extremely interesting to see how the geopolitics of the world will play in a bigger stage after this whole pandemic has kind of slow down and we go back to our usual normal, I guess I can call it. We have one more question from a participant. He or she states, will we expect a change in countries' demographic structure? And what implications will that have on society and countries' development?
Yeah, that's a really good question, because I think it's another one where we don't know yet what the impact of COVID will be, right? And in any case, I think that demographics for a long time were a bit neglected in general as a decisive factor of how our societies will develop, and also actually also of international relations. And I think what we realized over the last few years is that demographics are extremely important, with demographics slowing down extremely in Europe, but also Japan, right? To a point where, I mean, we've never seen this, where the really the structure of society is totally changing and putting up a strain on social safety nets and so on. And at the same time, we see a demographic evolution in Africa that is probably unprecedented in history. And we have to see, I mean, we don't know yet. I think I haven't seen in any case any like research so far on what COVID will mean in the longer run.
Thank you so much for that answer, Friederike. Well, there's nothing left to say except to thank you very, very much for taking this time to speak with us, for taking this time to share your experience and expertise with us. And once again, thank you so much for spending this time with us.
Thank you. Really great to have this opportunity, and yeah, and I enjoyed it a lot to discuss with you.
Thank you. Well, everybody, thank you so much for joining in on this talk with Friederike Röder. Again, she is the Senior Director for Government Policy for Global Citizen. We talked about the implications of COVID-19 and the EU global response to the pandemic. Once again, thank you so much for joining in. If you want more information, please go to www.pathforeurope.eu, where you can get more information, read different articles in different fields, and you can follow everything that we are doing. Once again, thank you all.